Let me talk about anxiety. So anxiety is a normal response to stress. So question come, what is stress? Stress is a body's physical or emotional reaction to any kind of pressure, maybe physical, maybe mental or emotional. So when we are undergo to the stress or anxiety, or if anxiety is persistent or excessive, originates or too much worried about something and causing the physical or psychological symptom, that means we can say anxiety disorder. So anxiety is subjective experience that include feelings of apprehension, uneasiness, uncertainty, or dread. Occurs as a result of threat that may be misperceived or misinterpreted, or as a result of a threat to identify or self-esteem, may result when the values are threatened or preceding a new experience. So who is more anxiety among the men and female? Usually female is the risk for anxiety. The type of anxiety, they said normal, acute, and chronic. Normal is a short-term, healthy type of anxiety. Acute means precipitated by any kind of loss or change that is threatening one's sense of security, or chronic anxiety that persists as a characteristic response to daily activities. And some books said the symptoms of anxiety are excessive anxiety or worriness. If it is more than 6 months, we call anxiety disorder. Sometimes patient present with restlessness, fatigue, irritability, muscle tension, or insomnia. So now, level of anxiety mild, associated with the tension of everyday life. The individual is alert and perceptual field is increased. Mild anxiety can be motivating and produce the growth, enhance the creativity, and increase the learning. So mild anxiety really not that much bad. We are going to sit for NCLEX board exam. If little bit anxiety, you can it help you, or it helps to read you more. In that point of view, we said sometimes mild anxiety can be motivating, make you productive, and increase the creativity, and also increasing the learning. So mild anxiety is normal, expected response to daily events. Highlightness or awareness or increase the perceptual field, allow for optimal functioning. So this is the benefit side of mild anxiety, or beneficial for learning. If you have mild anxiety, most of the times patients are restlessness, irritabilities, and increase the motivations. What else? Moderate anxiety, the focus is on sudden or decrease the concentration or attention span, or perceptual field, or may hinder problem solving. Moderate anxiety narrow the perceptual field, select the inattentiveness occurring, learning or problem solving still occur. But patient present with increase the heart rate, increase the respiratory rate, and sometimes patient present with gastrointestinal discomfort or muscle tension. In case of severe anxiety is a feeling that something bad is about to happen. A significant narrowing in the perceptual field. Focus is an minute to scattered details. All behavior is directed at relieving the anxiety. Learning or problem solving are not possible. So in case of severe anxiety, so greatly decrease the perceptual field. Difficulty to completing a simple task or effective learning is not possible. So if your patient has a mild or moderate anxiety, if you tell them and go for relaxation technique, breathing technique, exercise, they can do it. But in severe anxiety or panic level anxiety, it is not effective. Effectiveness learning is not possible. So usually if the patient have a severe anxiety, the most common presentation have feeling of death or headache, nausea, diarrhea, insomnia, palpitation, and hyperventilation. What else? Panic level anxiety. The panic is associated with death and terror or a sense of impending doom. The personality is disorganized. The individual is unstable to communicate or function effectively. Increase the motor activities occur, loss of rational thought, inability to concentrate occur, and if prolonged, panic can lead to exhaustion and death. So the panic level anxiety, loss to contact with reality, functioning and communication ineffective, and learning is not possible and can be life-threatening. The most common presentation of panic level anxiety, feeling of terror or impending doom, and also hallucination or delusion. Sometimes patient present with dilated pupil, severe trembling, or diaphoresis. Diaphoresis means sweating. So if your patient have an anxiety, then as a healthcare provider, what is our role or how we interact with them? So it's called nursing interaction. So we first of all, we recognize the anxiety, establish the trust, protect the client, and do not criticize in coping mechanism, or do not force the client into the situation that provoke the anxiety. Modify the environment by setting limit or limiting interaction with others. Provide creative outlet and provide activity That is, limit the amount of time for destructive behavior. So, three ways to cope with generalized anxiety disorder or anxiety disorder. So, we have to try to keep them busy, like social coping strategies, emotional coping strategies, and keep them busy by physical coping strategies. So if my patient has a mild and moderate anxiety, we help patient with problem solving, evaluate the coping mechanism, and also assessment the patient. And patient has successfully used in the past. We provide outlet to relieve the tension, like we educate your patient how to do coping mechanism, breathing technique, relaxation technique, or exercise, because all of these techniques reduce the anxiety. Here said, anxiety in a client. We provide a claim environment, ask the client to identify what and how he or she feel, encourage the client to describe and discuss his or her feelings, and help the client to identify the causes of feelings if he or she is having the difficulties doing so. Listen to the client for expression of helplessness. When you ask the open-ended question, then you give them time, be silent, and listen their problem, and let them express their emotion. Document the events, significant information, action taken, and follow-up actions, and also the what is client response. Here was something more about interaction. If a client experiences anxiety, or we can immediate action are to provide a claim environment, decrease environmental stimuli, and stay with the client, because safety is the most priority. Excessive stimuli would accelerate the anxiety. Next, asking the client to identify what and how he or she feels, and helping the client to identify the process of the feelings increase the client awareness of the connections between behavior and feelings. This awareness helps to decrease the anxiety while listening to the client, and the nurse observe for expressions to helplessness and hopelessness that could indicate the self-harm intentions. The healthcare providers follow up care as needed based on observations and assessment. Finally, the nurse documents the events and significant informations, actions taken, and follow-up actions, and also the client response. So if my patient has a severe or panic level anxiety, what should my um, response? Definitely, it is not same what I do for the mild or moderate anxiety. If patient has a severe or panic level anxiety, problem solving not possible for a patient experiencing severe or panic level anxiety. So what we can do? Let me read it first. Promote the relaxation technique such as breathing exercise or guided imaginaries, means visualizations. So monitoring the vital sign and admin anti-anxiety medication as prescribed. Most commonly medication we use is called benzodiazepine. So first of all, we have to diagnose our patient, rule out underlying condition. Even sometimes some medical condition can cause anxiety. Example, hyperthyroidism. So if medical pathology, this is a different way to management. We should management underlying cause like hyperthyroidism. If there are no pathological condition, means anxiety because of psychiatry or psychological issue. So rule out underlying condition is important. The treatment we should talk, or it is called talk therapy can work, or also uh, cognitive behavioral therapies. Hmm? Some pharmacology like SSRI, benzodiazepam, buspirone can work. First of all, we should provide the care for the patient based on anxiety level, right? And teach the patient how to recognize the sign of accelerating anxiety and intervention to reduce the anxiety, like deep breathing techniques and exercise. Now, here, mild to moderate level, help the client identify, encourage the client to talk, help the client identify thoughts and feelings, encourage the problem solving, and encourage the gross motor exercise. In case of severe or panic, reduce the anxiety quickly, use a calm manner, and always remain with the client, minimize environmental stimuli, provide clear, simple statement, and use a low-pitch voice. Attend to the physical need to the client and provide gross motor activities, admin, anti-anxiety medication. So, in case of severe or panic level, move the patient to quiet setting because safety is the priority, and keep and remain with patients. And when you talk to the patient, speak slowly and clearly. Provide for the patient's physical needs, means food, rest, shelter, and safety.